Hey everyone, the procedure that I decided to talk about today is a total hip replacement with a posterior approach. With the posterior approach, there is an increased risk of hip dislocation, so there are 3 precautions set in place by doctors and physical therapists for the patient to take. Now, these precautions need to be taken 3 months up until 3 months after the surgery and during everyday activities. The first precaution is that you don't want to flex your hip past 90 degrees or to 90 degrees. The way to measure that is you look at the patient's torso and the patient's femur, and if they make a 90-degree angle at the hip, they are flexing it too much. The next precaution is that the patient doesn't want to adduct their surgery leg past neutral, and they don't want to internally rotate their surgery leg past neutral. When a patient comes into the clinic, there are a couple things that the physical therapist needs to look at just to help the patient through the rehab process. So the first thing for the physical therapist to look at is to see what kind of surgery they had, if they had a cemented prosthesis or a non-cemented. So with a cemented, there tends to be less weight-bearing restrictions, and with a non-cemented, there tends to be a few more. It can be partial weight-bearing or toe-touch weight-bearing, but both of those also just depend on doctor's orders and patient tolerance and things like that. The next thing for the PT to look at is the incision site to make sure there isn't any infection present. Another thing that the PT needs to look at consistently through the rehabilitation is for DVTs or PEs, just to make sure that there aren't any blood clots occurring. Another thing to discuss with the patient is if they've had any falls since the surgery, because that can potentially dislocate their hip. Another thing is to discuss the history, if there's been surgeries at that hip before. And the last thing to look at is to see if they have any assistive devices. So if they're using a walker or crutches or a cane. One thing that is recommended for posterior approaches is an abduction wedge, which is worn during sleep because you don't want to adduct your leg, so it constantly keeps your leg abducted so that it doesn't potentially dislocate it during your sleep, because people tend to cross their legs during sleep. So with a posterior hip, there are several everyday activities that a patient has to do. So one of the things that I wanted to show you guys today was how to put on your pants and taking these precautions, not bending the hip at 90, not adducting or internally rotating it. Because usually when you put on your pants, you either bend at the waist and bend your hip 90 degrees, or you sit down, and sitting at 90 degrees can cause dislocation. So I'm going to show you guys how to put on your pants taking these precautions. First, I'm going to talk to you guys about how in normal circumstances someone will put on their pants and it can cause the hip to be bent to 90 degrees. So usually when someone puts on their pants, they lift their leg and bend, and it's causing the hip to bend at 90 degrees, and that can cause posterior hip dislocation. To put on pants to avoid breaking the precautions post-surgery, the patient first needs to find an elevated surface like a bed or a chair that you can put a pillow in, so that the hip isn't being bent to 90 degrees. So the way that you want to put your pants on is you kind of hold it in the non-surgery side. This is your injured hip, and you will place your foot, not lifting it to 90 degrees, keeping it not all the way bent, placing surgery leg into the pants first, pulling up as far as you can, and all of your weight is on the non-surgery leg. And then since you are on an elevated surface, you can kind of use the bed or the chair to help with your weight, and there are no precautions on your non-surgery leg, so you can bend it however you need to get it into the pants, and then the rest you can stand up and pull your pants all the way up, and that is how you put on pants with these precautions.